Good afternoon, students. My name is Dr. Avis Brown. I'm a board-certified nurse practitioner with a specialty in adult and gerontological primary care. I'm also one of 5 charter members of the Palm Beach County Black Nurses Association. The organization began in 2004 and has had an amazing, successful tenure and presence in Palm Beach County for over 18 years. We have enjoyed our partnership with TLJMS and look for many more events like this to come. I am currently the immediate past president of the Palm Beach County Black Nurses Association. Presently, I'm the CEO and founder of Brown DMP Healthcare Solutions, LLC. It's a mobile IV infusion company. I travel around the county providing IV vitamins infusion, IV hydration, and to people who want the convenience of being treated in their homes. I also work as a hospitalist nurse practitioner. As a hospitalist nurse practitioner, I specialize in diagnosing and treating a wide variety of illnesses. I do similar work to that of a primary care provider, just in the hospital setting. I was actually born here in Palm Beach County at the hospital that I currently work in. My nursing journey began in 1995. I needed a career that will allow me to be financially able to care for my children. I needed the flexibility of the 12-hour shifts, and the lucrative income that came with nursing was a bonus. I received my Bachelor's of Science from Barry University. I got my Master's of Science from FAMU, go Rattlers, and a DNP from Capella University. I gained experience in so many areas of nursing: pediatrics, case management, home health. I even worked in the ICU. Then I began to desire a broader scope of practice and autonomy. And so I became a nurse practitioner. I love being a nurse practitioner. I love the independence, the schedule flexibility, and the challenging workday that comes with being a nurse practitioner. Now, my job is tough, but it's active. No 2 days are exactly alike. Although many nurse practitioners function in a role that is at times similar to that of physicians, we do so differently because we look at our patients differently. Nursing is our art, and nurse practitioners take nursing care to a whole new level. Nurse practitioners provide expert nursing care and infuse that care with the medical approach. The goal is always health promotion and disease prevention. Nurse practitioners are experts at marrying the art of caring with the science of medicine with a holistic approach. What are NPs allowed to do? Well, this varies from state to state. And in general, most nurse practitioners function as a patient's primary health care provider. Nurse practitioners can order tests, we can prescribe medications and narcotics, and we can perform surgical procedures. We also refer our patients out to specialty providers. Nurse practitioners manage their own patients and follow up as necessary. If patients require care above and beyond the nurse practitioner's scope of practice, then we usually refer them to a physician colleague. In the state of Florida, nurse practitioners have independent practice. And that just basically means that nurse practitioners can practice to the full extent of their licensing without having to have a physician supervisor. To become a nurse practitioner, you must first need to be a nurse. You will have to become a nurse first, a registered nurse. And you will do this by enrolling in either an associate degree program in nursing or a bachelor's degree program in nursing. But both programs prepare you for being a registered nurse. And there are so many schools with so many different formats. There are no excuses. You can do it live, virtual, hybrid, accelerated, part-time, weekend, or a traditional 4-year degree program. If you want to do it, there is the ability to do it. So once you graduate from nursing school, you actually have to pass your nursing boards. When you graduate from nursing school, you're just a nurse. But when you pass your state boards, then you are a registered nurse. And the registered nurse, that's the part that counts. So now that you're a registered nurse, it's time to gain your nursing experience. And the areas and diversity for nursing are as wide open as you can imagine. If you decide you want to work at a hospital, there's medical surgical nurse. You can be a wound care nurse. You can do oncology nursing. You can do telemetry nursing. You can work in the emergency room or the operating room. You can be a case manager or utilization review nursing. If you decide, I think I want to work in the community as a nurse, there's hospice nursing. There's home health nursing. You can be an occupational health nurse. You can work as a jail nurse, a parish nurse, a flight nurse. If you can think of it, you can do it. You decide you want to be a nurse practitioner, you can become a midwife, a family nurse practitioner, an elderly nurse practitioner, a neonatal nurse practitioner, an acute care nurse practitioner. If you can think of it, trust me, you can do it. So a typical day for me starts at the hospital. I usually start pretty early. First thing I do is I round on my patients. I examine my patients, and then I diagnose my patients. I confer with specialists. I interpret lab values and radiological data. I make sure that my patients are cleared for surgery. If they're good and stable, they can go home. If they're not good and stable, they have to stay in the hospital for a few more minutes. They don't really like that, but it is what it is. Most people want to be healthy. Once I'm done with my rounds at the hospital, then I start my mobile IV infusion services. So I do IV hydration, IV high-dose vitamins, IV immune therapy, B12 injections. I'm also doing some COVID testing, COVID booster shots. I can do some concierge medicine in your home. I do everything that a primary care provider can do. I just use the convenience of coming to your house to do it. Once I go and see Mr. Scully, hi Mr. Scully, how are you doing today, sir? I'm going to do a complete head-to-toe assessment before we do anything. I'm going to make sure that he's stable to get the services that I'm providing for him. He might need a COVID test. He might need a flu vaccine. Mr. Scully might need to go to the hospital. He might need me to draw some labs. I'll also take some urine from Mr. Scully. I can do a physical exam on Mr. Scully. But for the most part, I'm also going to give Mr. Scully his IV high-dose vitamins or his IV hydration. Anything to make it more convenient for him. He's allowed to get all this stuff that he would get in my office, but I'm going to do it for him at home. So this is an exciting but challenging time for nurses, for nurse practitioners, and healthcare workers in general. It actually took a pandemic for a lot of the public to realize just how essential we are in this field. However, your life can't just be about being a nurse. And for myself, I love to travel. That's my downtime, and that's my happy place. I make sure that I take time to travel with my husband, to travel with my children, to travel with my parents, to travel with my best friends and my girlfriends, and to travel with my grandchildren. And that's one of the great things about being a nurse or a nurse practitioner. You have that flexibility of your schedule where you can schedule a large amount of time off to be able to do those things that bring you joy. I'm also very, very involved in the community. I'm a member of Zeta Phi Beta Sorority Incorporated, and we do so much in the community as far as COVID testing and flu vaccines and serving the homeless and serving children in need. So make sure you always, when you're a nurse, you make sure you have those things that balance your life and balance your work, because it can't always be about work 24 hours a day. You cannot bring your work home with you. You have to keep it at the job. When you decide to become a nurse or nurse practitioner, understand it is a rewarding career with good opportunities for advancement, stability, and compensation. And there are so many resources available to assist you in becoming a nurse. Local, state, and national scholarships. They are all available. They're geared toward nursing and nursing education. There are grants, there are job searches, and there are community-based organizations like T. Leroy Jefferson and the Palm Beach County Black Nurses Association that provide mentorship and preceptorship opportunities. Never let the cost of an education deter you from pursuing your dreams and reaching your highest potential. I am Dr. Avis Bradley Brown, and I approve this message.